Let's discuss the five elements theory, the fundamental concepts. Five elements theory belongs to the category of ancient philosophy. It believes that the world is made of five basic substances with specific forms, namely wood, fire, earth, metal, and water. These five substances are in a state of mutual generation and restriction. Due to this fact, the world moves and changes constantly, and everything in this world is directly or indirectly related. When the theory of the five elements is applied in TCM, it helps the TCM doctors to recognize the internal relationship inside the body as well as its connection with its outside surroundings. So we have here the fundamental concepts and characters of the five elements, the key points. Fundamental concepts of the five elements, it refers to the mutual connection and their change of movement among the five elements. The characters of five elements, the wood is characterized by bending and straightening. Fire is the flaming upward. Earth is the sowing and reaping. Metal is the working of change, and water is the moistening and descending. First, the fundamental concept of five elements in Chinese, Wu refers to five different subjects, namely wood, fire, earth, metal, and water. Xing has two meanings. One refers to the order, while the other refers to movement and change. Therefore, Wu Xing, or the five elements, refers to the connection, movement, and changes among the five elements. The characters of the five elements, the concept of five elements was once the abstract conceptualization of climatic feature and phenological characteristics for five-time interval of the Yellow River Basin. Respectively, wood indicates everything grows in warm spring. Fire indicates everything thrives in hot summer. Earth indicates everything transforms in moist late summer. Metal indicates everything restrained in cool and dry autumn. And water indicates everything stores and hides in cold winter. The feature of five elements can be generalized by climatic characteristics of spring warm, summer hot, late summer moist, autumn dry, and winter cold, as well as by phenological change characteristics of growing, thriving, transforming, restraining, and storing. Sang Su Hong Fan wrote, wood bends and straightens, fire burns and flares up, earth provides for sowing and reaping, metal works for change, water moistens and flows downward. Hence, feature of five elements become wider and abstracter. With the practice of everyday life and production, characteristics of five elements were gradually developed and formed by ancient people through their life experience and recognition towards element of wood, fire, earth, metal, and water. The characteristics were mainly used to analyze and generalize the attributes of various things in the five elements and to study the connections among different subjects. Therefore, the characteristics of five elements have gone beyond their concepts. Characteristics of wood. Wood bends and straightens, which means stems and branches of a tree can bend, straighten, and grow upward and outward. Thus, it is inferred that anything that has the function or property of growing, developing, and flourishing is attributed to wood. Characteristics of fire. Fire burns and flares up, which means that fire has the characteristics of warm, heat, and ascending. Thus, it is inferred that anything that has the function or property of warm, heat, and ascending is attributed to fire. Characteristics of earth. Earth provides for sowing and reaping, which means that earth can be used for sowing and reaping. Thus, it is inferred that anything that has the function or property of generating, holding, and receiving is attributed to earth. Characteristics of metal. Metal works for change, which means that metal has the characteristic of clearing and descending. Thus, it is inferred that anything that has the function or property of clearing, descending, and as changing is attributed to metal. Characteristics of water. Water moistens and flows downward, which means that water has the characteristics of moistening and descending. Thus, it is inferred that anything that has the function or property of cold and coolness, moistening and descending is attributed to water. Thank you for your attention.
Let's now discuss interviewing for those with heart palpitations. The main area of inquiry about the heart is whether there are palpitations, cardiac pain, or pain in the chest. It is important to note that palpitations in Chinese medicine are not limited to a rapid heartbeat or a powerful heartbeat. Palpitations in Chinese medicine are all situations where the person can feel the beating of their heart, because normally you should not be conscious of your heart beating. Palpitations, where there is also a sense of emotional turmoil or anxiety, will be due to gallbladder and heart qi deficiency, heart yin deficiency, heart blood deficiency, or excess heat. Heart yin and heart blood, as well as nourishing the physical aspects of the heart, nourish and anchor the heart's shen aspect, which means that it's not only the physical aspect of the heart that becomes imbalanced when these are weak. Heat can agitate the shen and simultaneously overactivate the physical aspects of the heart. This will also give rise to palpitations and emotional turmoil. Gallbladder and heart qi deficiency results in a person being very nervous, and their shen lacks the ability to control their heartbeat when they are nervous. If the palpitations are of a more purely physical nature, it is more likely that there is heart qi stagnation, heart qi deficiency, heart yang deficiency, or heart blood stagnation. If heart qi or heart yang are weak, they can no longer control the rhythmic beating of the heart. Blood stagnation can block heart qi and heart blood, so they can no longer perform their functions. Heart blood stagnation will also usually manifest with cardiac or chest pain. The sensation of the heart beating felt in the chest by the patient is a definition of palpitations. It is caused by either an increase in heart rate, an increase in heart contraction, or irregular heartbeats. It is often present in various kinds of coronary heart disease, cardioneurosis, anemia, and hyperthyroidism. Palpitations can also arise in a healthy person during periods of exercise or emotional excitement. Depending on its severity, palpitations can be divided into the following categories. Fright palpitations refers to heart palpitations that occur when there is fright. It is usually due to some external cause. They come and go quickly and are of short duration. This condition is mild, and patients do not usually seek out treatment for fright palpitations. Continuous palpitations refers to severe throbbing of the heart, which is often felt from the chest down to the umbilicus. It is a further development of fright palpitations and is usually due to internal causes. It is induced or aggravated by exertion. Prolonged duration of this condition is severe and may require medical attention. Palpitations are directly related to the condition of the heart. Under normal conditions, the spirit resides inside the heart and is nourished by blood, qi, essence, and body fluids. When the heart is attacked by pathogenic factors, such as phlegm or blood stasis, or if the heart is deprived of nutrition due to deficiency of qi, blood, yin, yang, then the spirit will be disturbed and restless, which causes fright palpitations. Continuous palpitations represents further exacerbation of the fright palpitations and is viewed as damage to the heart organ rather than just a functional pathology. So the pathogenesis of heart palpitations is as follows. So water, blood, stasis, and phlegm can attack the heart, leading to a disturbance of the spirit, leading to heart palpitations. Or there may be already a qi, blood, yin, or yang deficiency, and this fail to nourish the heart, which disturb the spirit, leading to heart palpitations. Palpitations with paroxysmal pain may be stabbing or colicky in nature. Radiation into the left arm indicates blood stagnation. Palpitations come and go, induced by anxiety or fright. Dizziness, vertigo is a phlegm disturbing the heart. Palpitations with sudden onset induced by fright or panic attack is seen in emotion as a fright or disturbing the heart. Palpitations with stifling sensation in the chest, shortness of breath, edema in the lower extremities or the face, water attacking the heart. So these are excess conditions. For deficiency conditions, palpitations with irritability or fright, insomnia, poor memory, dizziness, blurred vision, pale face would indicate heart blood deficiency and heart yin deficiency. Palpitations with shortness of breath, palpitations induced or aggravated by exertion or by any physical or mental activity indicates heart qi deficiency or heart yang deficiency. So palpitations with a concurrent sense of emotional turmoil or anxiety signifies heart yin deficiency, heart blood deficiency, heat, gallbladder, and heart qi deficiency. Palpitations with a tight sensation in the chest is heart qi stagnation. Palpitations with stabbing pain in the chest is heart blood stagnation. Thank you for listening.
Diagnosis according to pathogenic qi, the SummerHeat. The pathogen is yang in nature. It is the prevailing qi of summer. But the major difference between SummerHeat and the other forms of climatic qi is that SummerHeat is the only form of pathogenic qi that is exclusively associated with a specific season. The other forms of exogenous pathogenic qi can invade the body all year round. But SummerHeat invasion are solely seen in the summer. Furthermore, all of the other 5 forms of climatic qi can manifest with related internal imbalances in the body. For example, the signs of cold manifest in a yang deficient condition, or signs of heat manifest in a yin deficiency condition. This is not the case with SummerHeat, which is exclusively an exogenous form of pathogenic qi. SummerHeat can arise when a person has been overexposed to the sun, especially on their head. A contributing factor can be that the person has overexerted themselves in the sun and has thereby weakened their Shen Qi, which includes the Wei Qi. It is usually seen in people who physically overexerted themselves playing sports, working, etc. on days when the sun is very strong, or in elderly people whose Wei Qi is weak. There are 3 different kinds of SummerHeat: SummerHeat warm, SummerHeat dampness, and SummerHeat stroke. SummerHeat is a very young pathogen and has an upward and outward dynamic, which means that it tends to affect the head. Most of the signs of SummerHeat are almost identical to heat signs. Because SummerHeat is a heat pathogen, SummerHeat will therefore also injure yin. Typical symptoms and signs of an invasion of SummerHeat are high fever, aversion to cold, profound thirst, excessive sweating, red face, headache, rapid swallow breathing, shallow breathing, mental restlessness, and agitation. SummerHeat will result in the heartbeat increasing and therefore a rapid pulse. The pulse will also be superficial. A sign of SummerHeat that may require further explanation is that there is often an aversion to cold despite the fact that the person has extreme heat signs and symptoms. This is because the SummerHeat will have invaded the exterior and disrupted the circulation of body's Wei Qi. This is the same pathomechanism that is seen in an invasion of wind heat. Exogenous pathogenic qi disrupts Wei Qi in its function of circulating and warming the area below the skin. The other symptoms all relate to heat damaging yin and fluids in the body. Although SummerHeat is located in the Wei aspect, it can quickly penetrate deeper into the body. It can penetrate down to the pericardium, blocking a person's shen. This can result in a loss of consciousness, incoherent speech, or agitation. This is seen when there is summer heat stroke. The heat is so intense here that it generates wind in the body, and the person may also have cramps and spasm. If the weather or the environment is very humid, while the sun is very intense, or if the person consumes large amount of cold fluids, the dampness can combine with the summer heat and create the pattern of summer heat dampness. Here, there will be symptoms and signs resulting from exposure to heat from the sun, but at the same time, there will also be perceptible signs that dampness has disrupted the movement of qi, especially in the middle jiao. Etiology, exposure to intense sunlight in the summer. Symptoms and signs, there is fever, thirst, red face, there may be aversion to cold, headache, dark urine, rapid and superficial pulse. For the symptoms and signs of specific types of summer heat invasion. In summer heat, profuse thirst, profuse sweating, or no sweating in the body's fluid have been damaged by heat. Red face, headache, rapid, shallow breathing, restlessness, and agitation, rapid and full pulse. Next, the summer heat dampness. There is persistent low fever, no strength, heaviness in the arms and legs, bloated abdomen, nausea, loose stools, sparse and yellowish urine, thick, greasy yellow tongue coating, rapid, full, and slippery pulse. Next is the summer heat stroke. There is dizziness, headache, tightness in the chest, dry mouth, thirst, fatigue, nausea. In extreme cases, there may be a loss of consciousness, spasm or convulsion, rapid and wiry pulse. For the treatment principle, we have to expel summer heat. The acupuncture points, we have to choose from UB40, LI4, LI11, Sanjiao 5, Do14, and Do20. If the person has lost consciousness, we have to bleed pericardium 9 and heart 9. Needle technique is draining, bleeding on Do14, pericardium 9, and heart 9. For the explanation, LI4, LI11, and Sanjiao 5 expel summer heat from the exterior. UB40 and Do14 clear and expel summer heat. Do20 sinks heat from the head. Pericardium 9 and heart 9 drain heat from the heart and revive consciousness. The relevant advice with this pattern, prevention is important. This means that it is important to avoid prolonged exposure to strong sunlight, especially on the head. It is therefore advisable to wear a hat or scarf on the head in the summer. It is also important to consume ample fluids when it is hot in the summer. This is because if you become dehydrated or Jinya deficiency in Chinese medicine, it will more easily create an imbalance and further injure yin. Chrysanthemum tea is particularly recommended. Summer heat can be caused by the following pattern of imbalance, Wei Qi deficiency, and summer heat can result in the following pattern of imbalance, internally generated wind. Thank you for your attention.
We continue our discussion on diagnosis according to 6 stages. This time we discuss Yangming Channel Syndrome. So what is the Yangming stage of an illness? From the Taiyang aspect, if exogenous pathogenic qi is not expelled, or if it has been treated improperly or inadequately, pathogenic qi will penetrate into one of the deeper aspects. The pathogenic qi will usually penetrate into the Yangming aspect. When pathogenic qi is in the Yangming aspect, the disease is no longer in the exterior. This means that many of the signs and symptoms that characterize the Taiyang stage will not be present here. This is because the clash between the upright qi and the pathogenic qi is no longer between the superficial weight qi and pathogenic qi, but is taking place deeper in the body. The body's joint qi is still strong, which means that the struggle and thereby the resulting symptoms and signs will be strong. This is a pure excess condition. The struggle between the upright qi and the pathogenic qi will generate a lot of heat. Yangming is rich in qi and blood. This means that the symptoms in this stage will be especially ferocious. When pathogenic qi has penetrated into the Yangming aspect, the symptoms picture is characterized by the 4 grades, namely a great high in fever, a great thirst, great or profuse sweating, and a great flooding pulse. The heat generated by the struggle will cause the person's body temperature to rise. At the same time, the intense heat will send qi upwards and outwards in the body. This rapid expansive movement of qi will drive fluids to the surface of the body and out through the pores in the skin, which is why there is profuse sweating in the initial stages. The intense heat and sweating will injure the fluids, and the person will therefore develop a great thirst with a desire for cold drinks. The presence of intense heat will be reflected in the pulse, which is flooding and rapid. The face will usually be red in color, and the person will feel hot when palpated, especially on the forehead. The heat can also affect their shen and cause them to be physically and mentally restless, have difficulty sleeping, and be irritable. If the heat is very intense, they may lose consciousness or be delirious and raving. Heat can also agitate qi in the chest, causing the person to have a sensation of turmoil in the chest. Heat will also be visible on the tongue, which will be red with a dry yellowish coating. Zhang Zhongqing mainly differentiated between pathogenic qi located in the channel and in the organ aspects. The main difference between the two patterns is whether there is constipation or not. Heat in the stomach and large intestine organs will desiccate fluids in the organs, resulting in constipation and abdominal pain. So now let's talk about the Yangming Channel Syndrome. The channel pattern is characterized by formless pathogenic heat that spreads throughout the body, driving fluids up to the skin. An important difference between the Yangming and Taiyang stages is that there is no aversion to cold in the Yangming stage, but there will instead be an aversion to heat. While pathogenic cold in the Taiyang aspect will have resulted in the person packing themselves under blankets and quilts in an attempt to warm the skin and the muscles, the person will now kick off the bedding in an attempt to cool down. This is because in the Taiyang stage, the wind and cold will have blocked wei qi so that it cannot warm the skin and muscles. In this stage, the struggle between the upright qi and the pathogenic qi is generating so much heat that the body is overheating. So for its etiology, there is insufficient or incorrect treatment of exogenous pathogenic qi in the Taiyang stage, or pathogenic qi is strong enough to penetrate deeper if the person has already a heat condition, or if there is an excess person, the symptoms will be more extreme. The symptoms and signs. So there will be strong fever, but no aversion to cold, profuse sweating, great thirst with a desire for cold drinks, irritability, delirium, turmoil in the chest, red face, the skin feels hot, mental and physical restlessness, dark urine, red tongue, yellow and dry coating, a rapid flooding and full pulse. The key symptoms here are high fever and no aversion to cold, thirst, profuse sweating, constipation, rapid and flooding pulse. The treatment principle, we drain heat from the Yangming aspect. For the acupuncture points, we can choose from LI 11, stomach 44, stomach 43, REN 12, and do 14 with the draining needling technique. So for further explanation, LI 11, stomach 44, stomach 43, and REN 12 drain the Yangming heat. Do 14 drains excess heat. The patient should eat foods that are cooling and moistening, and they should avoid food and beverages that have a hot energy. The Yangming channel pattern can be caused by the following patterns of imbalance: the Taiyang stage invasion of exogenous pathogenic qi. And in turn, this can result to Yangming organ stage, the Shaoyang stage, Taiyin stage, the Shaoyin stage, and finally the Juyin stage. Thank you for your attention.
We now proceed to combining points, principles. Qi circulation in the channel system. The head is the highest part of the body, not only anatomically, but also energetically according to the flow of qi in the 12 channels. It is in fact the area of maximum potential of energy in the circulation of qi in the channels. Qi circulates in the channels because there is a difference of potential between the chest and the head. Potential energy is a stored energy. An object can store energy as the result of its position. For example, the heavy rum of a pile driver is storing energy when it is held at an elevated position. Similarly, a drone bow is able to store energy as the result of its position. Potential energy is the stored energy of position possessed by an object. Gravitational potential energy is the energy stored in an object as the result of its vertical position, that is, the height. The energy is stored as the result of the gravitational attraction of the Earth for the object. The gravitational potential energy of the heavy rum of a pile driver is an example of gravitational potential energy. So this is an illustration of the potential energy. The qi at the top of the head possesses a gravitational potential energy as a result of its position at the top of the body. In the circulation of qi in the channel system, the top of the head has the maximum and the chest abdomen the minimum potential. Qi circulates precisely because of the difference in potential between the head and the chest. If we consider the first 4 channels, for example, we see that qi starts at the chest area in the lung channel. This is the area of minimum potential of energy. In order to understand this, we can visualize a certain amount of water at the bottom of a hill, where its potential of producing energy is minimal or nil. If we slowly carry this water up the hill, gradually its potential of producing energy will increase. As we know, when the water reaches the top of the hill, its potential of producing energy, for example, hydroelectric energy, will be maximum. The bottom of the hill corresponds to the chest, halfway up the hill corresponds to the hands or feet, and the top of the hill corresponds to the head. So this is the illustration of potential energy in qi circulation. Thus, from the lung channel in the chest, qi starts to move upwards towards the head. At the fingertips, qi changes polarity. That is, it flows from the yin lung channel to the yang large intestine channel, but it is still flowing towards the head and its potential is increasing. When it reaches the head, the potential is at its maximum and it then starts decreasing as it flows towards the feet. At the feet, qi changes polarity. That is, it flows from the yang stomach channel to the yin spleen channel, but its potential is still decreasing as it flows towards the chest area. When it reaches the chest, the potential is minimum. The water has reached the bottom of the hill again. The qi from the spleen channel then connects internally with the heart channel, and a new 4-channel cycle starts in exactly the same way. So here you could see the cycle of qi circulation in the first 4 channels. The lungs, large intestine, as you can see, it reaches the peak on the face, then it goes down again, reaching its minimum potential in the spleen. This is the cycle of qi circulation in the 12 channels. So we shall be discussing this in detail as we continue with our discussion on the combining points principles. Thank you very much for your attention.
Diagnosis according to Sang-Fu organ patterns, the stomach imbalances. The stomach is the only fu organ directly involved in the production of qi, blood, and yin. This is because the stomach is the organ that receives the food and liquids that had been ingested through the mouth that will be transformed into wu qi and yin. The stomach rots and ripens the ingested food, preparing it for transformation by the spleen. The stomach also has the important function of sending qi downwards together with the impure residues that are left behind after the transformation process. The spleen simultaneously sends its qi upward together with the pure qi that has been extracted from the food and liquids. This qi mechanism is of great importance, not only for the movement of qi in the middle jiao, but also throughout the body as all communication passes through this area. It is crucial for the entire production of vital substance in the body that the stomach is capable of emptying and filling. If the stomach cannot send the impure residue down to the small intestine, there will not be any space in the stomach to receive new food or liquids. This will initially be experienced as a loss of appetite, nausea, bloating, or a stuffed sensation in the epigastric region. Because the stomach and spleen qi ji has ground to a halt, and this is an accumulation of qi, food, and liquids in the area. When the qi stagnates, it can also manifest with pain and discomfort. If the qi from the stomach cannot descend, it can become rebellious and ascend upwards. This can give symptoms such as hiccups, belching, but it can also become so rebellious that there is vomiting. If the rebellious qi has arisen from a deficient pattern, there will not be the explosive vomiting that characterizes excess pattern, but instead involuntary regurgitation. Disruption and disturbance of the stomach's descending function can also manifest as constipation. This is because the intestine are partly dependent on the downward dynamic of the stomach qi. If the disruption of the stomach and spleen qi ji becomes a chronic condition, it will affect the production of the vital substances, and this will manifest with symptoms such as fatigue and weakness of the muscles. Because the stomach is the organ that receives all the food and liquid that have been consumed, what has been ingested will have a significant influence on the stomach. The stomach has a preference for moist, damp substances, and it's damaged by dryness. This stands in contrast to the spleen, which abhors dampness. The stomach is easily damaged by heat and has a tendency to develop heat patterns of imbalance. Again, the spleen is the opposite. The spleen is injured and burdened by cold and prefers warmth. All of this means that the stomach is harmed by food and beverages that are energetically hot, and that its yin aspect is easily injured by the spicy food. Because this is often hot and because the spicy flavor itself can injure yin. If there is an excess of heat in the stomach, as there is with stomach fire, the food will be burned up in the stomach and the person will experience a gnawing and insatiable hunger because the stomach is constantly empty. The fire can be so intense that it begins to damage the organ itself. This will be perceived as shearing searing, pain, or burning sensation in the stomach due to its inherent yang dynamic, fire ascending upwards. This can cause stomach chi to become rebellious and flows upwards. This will manifest as hiccups, acid reflux, heartburn, and belching. Heat tends to make things become odorous, and this combined with the ascending chi from the heat can manifest as bad breath. Stomach yin deficiency heat will not result in the same intense hunger as when there is stomach fire. When yin deficiency creates deficient heat, there will be an increased hunger, but unlike when there is stomach fire, the person will be quickly satiated. Yin deficiency will not cause the stomach chi to become rebellious, and there will not be the same burning pain in the stomach. There can be more of a dull, stinging discomfort in the organ. Heat will also make the person thirsty. If the person is stomach fire, there will be an intense thirst with a desire to drink large quantities of cold beverages in large gulps. Yin deficiency heat will also result in thirst, but in this case, there will not be the same need to drink large gulps, more a preference for sipping water. Often, there is only a dryness of the mouth and throat when there is stomach yin deficiency, not because of the heat, but because this stomach is the root of yin fluids. Stomach yin deficiency can therefore lead to dryness throughout the body. The dryness can also manifest with constipation due to the stools being dry. Stomach heat, both deficient and excess, can similarly manifest with constipation. Thank you for your attention.
Let's continue our discussion on diagnosis according to 8 principles with yin and yang imbalances. The categories of yin and yang can, in general, be seen as encompassing the other 6 categories. The differentiation of yin and yang can also be used as a specific diagnosis in certain situations. In general, the differentiation of exterior, heat, and excess can be defined as yin yang qualities. Interior, cold, and deficiency, on the other hand, are yin qualities. In practice, though, it can often be difficult to say whether something is purely yin or yang. Wind cold, for example, is an exterior condition and an excess condition, both of which are defined as being yang, as is wind, but cold is yin. River fire is an interior condition that is yin, but it is also a fire condition which is yang. Although it is often difficult to define a condition as being purely yin or yang, in situations where we are in doubt about our diagnosis, we can simplify the diagnosis by taking a step backwards and asking ourselves whether the condition is essentially a yin or a yang condition and treat it as such. We can utilize yin and yang differentiation to be specific and focused when we want to define an imbalance precisely. For example, it is not enough to diagnose a person as being kidney deficient, but through the symptoms and signs that are manifesting, we can explicitly define the imbalance as being either kidney yin deficiency or kidney yang deficiency. The differentiation of yin and yang is especially relevant when diagnosing yin deficiency and yang deficiency conditions. Yin excess and yang excess conditions are generally the same as excess cold and excess heat, but also encompass conditions, various other imbalances such as dampness and internally generated wind. Here are the following differentiations in facial color, energy level, and movement. So the facial color in yang deficiency is matte and white as compared to red if there is yang excess, and in yin deficiency, there is only red cheekbones, and a bright white complexion or facial color in yin excess. So a person or a patient with an energy level which is tired and lethargic is having a yang deficiency, while he or she will be restless or manic if there is yang excess. And if there is yin deficiency, the energy level will be tired or restless. Her movements will be sluggish and slow if there is yang deficiency, fast, powerful, and hyperactive in yang excess, quick, restless, and fidgety if there is yin deficiency, and stiff and rigid if there is yin excess. As for the person's mental state, he or she will be sluggish and lacks motivation, and a slow thinker if the person is yang deficient. He or she will be manic, irritable, aggressive, restless, and will be having difficulty concentrating due to a cascade of thoughts if there is yang excess. There will be mental restlessness, nervousness, and unease if there is yin deficiency, and he or she can have a difficulty in thinking clearly and focusing when there is damp phlegm in yin excess. The stools will be loose or with watery diarrhea, if possible, that there is constipation when yang qi is too weak to move the stool through the intestines if the person is yang deficient. There will be constipation if there is yang excess, and also constipation in yin deficiency. Whereas there will be diarrhea or loose stools in yin excess. As for urination, there will be frequent copious amounts of clear urine in yang deficiency, dark scanty urine, possibly painful urination in yang excess, a dark sparse urine in yin deficiency, and either inhibited or painful urination or copious amounts of clear urine in yin excess. The voice and speech will be weak and soft. The person will talk slowly, and there will be reluctance to speak. If there is yang deficiency, the voice and speech will be loud, garrulous, and talks quickly. If there is yang excess, the person will be nervous and will have a quick, soft, and weak and dry voice in yin deficiency, and the voice and speech can be nasal in yin excess. There will be a slow, deep, and weak pulse in yang deficiency, large, rapid, and full pulse in yang excess, and empty and superficial or fine, possibly rapid pulse in yin deficiency, and a tight pulse in yin excess. The tongue will be pale, swollen, and wet in yang deficiency, red with yellow coating in yang excess, thin, red, cracked, or peeled tongue in yin deficiency, and a pale with a thick white coating in yin excess. The person will have an aversion to cold, freezes easily, and with cold limbs if there is yang deficiency. There will be fever or aversion to heat, and the skin will feel hot in yang excess. There will be the person will be feeling hot in the evening and at night. The palms of the hand and the soles of the feet can feel hot if there is yin deficiency, and in yin excess, the person will feel feels cold, and the skin will feel cold. So apart from yin deficiency, yang deficiency, yin excess, and yang excess, there are also two conditions known as collapse of yin and collapse of yang. These are perilous and life-threatening conditions in which yin and yang are separating from each other. These are therefore very serious conditions and often occur just before death. Thank you for your attention.
We now discuss acupuncture points for depression. Lung 7 brings clear qi up to the head and promotes the descending of turbid qi from the head. On a physical level, this means that lung 7 can treat problems of the nose and sinuses. On a psychic level, it clears the mind and lifts the mood. We use it for most types of depression, whatever the pattern involved. So here you could see the illustration on how lung 7 and lung 3 work to effect depression. Lung 7 brings, so we use lung 7 for most types of depression, whatever the pattern is involved. Lung 3, the actions and indications are closely related to its being a window of heaven point. One of the characteristics of this point is that they regulate the ascending and descending of qi from the body to and from the head. They do so in the crucial neck area, which is the gateway between the body and the head. Therefore, they can both subdue rebellious qi and promote the ascending of clear qi to the head. On a psychic level, this point's action in regulating the ascending and descending of qi to and from the head has a mental emotional effect. For example, insomnia is due to qi ascending too much to the head or not ascending or not descending from it, while somnolence and forgetfulness are due to clear qi not ascending to the head. The explanation of the acupuncture points says that lung 3 can make the qi rise to treat forgetfulness, sadness, and weeping due to qi not rising to the head. Forgetfulness is an important indication for lung 3. This is forgetfulness due to clear qi not rising to the head. This point treats forgetfulness by stimulating the ascending of qi of both the lungs and heart. Talking to ghosts features heavily in this point's indications. Generally speaking, when ancient books mention talking or seeing ghosts among the indications of a point, it means the point is indicated for relatively serious mental emotional problems, and in particular when the mind is obstructed. Obstruction of the mind can potentially cause serious mental problems such as manic depression or psychosis. Again, this point can open the mind's orifices. That is, they obstruct the mind by regulating ascending and descending of qi to and from the head. It opens the mind's orifices by promoting descending of turbid qi from the head and the ascending of clear qi to the head. This is a general function of the window of heaven points. Li4 has a strong influence on the mind and can be used to soothe the mind and allay anxiety, particularly if combined with liver 3 and with DO24 and GB13. We use this combination in depression accompanied by anxiety. Stomach 36 has a powerful tonic action, and on the psychic level, it lifts mood in patients who are depressed against a background of qi and blood deficiency. Thank you for your attention.